I wanted to make this series of videos just to kind of help people along in the same process. If you have the same thoughts, the same concerns, the same, worries that I had, I really want to just kind of put your mind at ease. I'm now 2 weeks past my retina detachment surgery, and I wanted to do this video while it's still somewhat fresh in my mind. I want to give you guys my experience during the surgery. Before I had my surgery, I kind of went all through YouTube looking for videos from other people that had, the same surgery or a similar surgery. I wanted really to know their experiences, what happened during their surgery, what did they remember, and I had trouble finding it. Most of the time I couldn't find, the information I was looking for. Sometimes some of the videos would actually touch on the topic briefly and then move on. To a lot of people, the surgery itself really wasn't that big of a deal. I really want to make this video while all the information is still fresh in my mind. My surgery was 2 weeks ago. I had a retina detachment in my right eye, and I needed PRP laser in my left eye. So the surgery was to repair the retina detachment in my right eye and then do a vitrectomy in my right eye, and then PRP laser in my left eye. So I'll just start at the top. We got to the clinic and got signed in. They got me back. I got changed into my gown in the pre-op area. They put in my IV. At that point, the anesthesiologist came in and talked to me and let me know basically what the procedure was going to be, which matched up with what my doctor had told me the week before. They were going to do the laser in my left eye and the vitrectomy and retina repair in my right eye. When the anesthesiologist came in, she said she was going to give me something to help me relax, and that would cause me to not really care what happened during the surgery. They kind of do whatever. She said they were also going to restrain my wrist, that way I wouldn't reach up and try and touch my face, which apparently people try to do all the time. That's one part of the surgery that I really didn't like, but again, I had the medicine, so I really didn't care. She let me know that they were going to put me under for about 5 minutes real quick so the doctor could come in and put the nerve block in my eye so I wouldn't feel anything. And that was really the part that I was most concerned about, because I'd heard people talk about it on the videos. One guy even mentioned clamping the nerve. I don't know how they would have done that, and it kind of had me freaked out a little bit. But it was just a nerve block, and they put me under for that. So the doctor came in, and he got a marker, and he marked above my eye, what they were doing in this eye, what they were doing in this eye. Anesthesiologist did the same thing, and the nurse came in, did the same thing, the doctor came in, did the same thing again. So I had writing all over my forehead, as you can see in the picture. At that point, the anesthesiologist and the nurse came back in along with the doctor, and the doctor picked up this massive syringe full of a numbing agent, needles like that long. And at that point, if they hadn't have already given me something to calm me down, then I would have probably freaked the hell out at that point, but I didn't care. And anesthesiologist said, okay, so we're going to give you something to make you go to sleep. They're going to put in the nerve block. You're going to be out for about 5 minutes. Then you'll wake back up and we'll wheel you back to do the surgery. I said, okay. And the last thing I remember her saying was timeout 9:40. And the doctor's over thumping his syringe, and he said, okay. And I was staring at the light above the bed, and I don't even remember what I was thinking, but my thoughts were kind of interrupted. I'm like, well, when are they going to when are they going to knock me out? I'm still awake. And then that's the point when I realized my right eye was closed and it was taped shut and there was a patch over it. I'm like, wow, they must have already done it. So the nurse came in and said he was going to give me something for pain to keep me from feeling stuff during the operation. So he did. My entire body started tingling. And they'd already given me something to kind of relax me and calm me down. So I said, oh, that's nice. Like an idiot. And then they wheeled me back to the back, and I'm talking about, World of Warcraft, and letting them know I'm talking about wizards and fireballs and zombies and stuff, that, there's a reason for that, just ignore it. And he said, yeah, don't worry about it, man. We hear it all. So that's really the last thing I remember. When I woke up, all I saw was a bright yellow light in my right eye. My left eye was taped shut. There was a patch over it, so I couldn't open it. I didn't want to. I could feel a towel over my face, and that was where they had really laid down the cloth for their sterile field. So that was on my face. My hands were restrained, which I do remember them restraining my hands before they put me out, just to stop me from trying to touch my face. But yeah, so all I saw was the bright yellow light in my right eye. It was more of an amber color, like looking at a light through a glass of tea or whiskey, whatever your preference is. and I could actually see one of the little tools that he had put in my eye to kind of do the snipping to pull the scar tissue off. All I remember is it was just coming across my vision and then angled, and I could see the little snips on the end of it. Then I could see him, he would come in with the other side with another tool and then grab something and then come in and snip at it and then pull. And it was a weird experience. It wasn't painful at all. It wasn't uncomfortable. They had given me something to calm me down, to help me relax, so I really didn't care. And they had already told me, we're going to give you this and it's going to make you relax and you're not going to care what we do to you. And that was true. They could have done just about anything. Actually, they could have done anything. I wouldn't have cared. Once the surgery was complete, he pulled everything out, closed my eye, patched it up. And I was awake from that point on until they wheeled me back out in the recovery room and sat me up. But I was very worried. I was very concerned. I was stressed. I was on borderline losing it over this surgery. I don't like surgery. I don't like anything to do with medical procedures. And this is more than just a regular surgery. This is my vision. If he nicks something, if he messes something up, or if it doesn't go right, I'm not gonna be able to see out of that eye for the rest of my life. But fortunately, everything went well. The doctor was very, very skilled, and he said my retina looks great now, which it doesn't feel great. I'm still a little sore, still a little irritated. Nothing has been painful to the point where I would say it actually hurts. My right eye just itches and burns a little bit every now and then. He did put stitches in there because he told me during my follow-up appointment that my the ports he'd put in, the 3 ports, had started leaking. Once he pulled the ports out, he said usually it's 25 gauges, so it's super small. Usually it just seals itself, but he said I was leaking a little bit, so he went ahead and put in sutures in each porthole. So that's really what's irritating my eye more than anything. That's really what's itching and burning. But it's not bad. It's just every now and then it itches, and I'll have to scratch it. I have a very bad habit of wanting to touch my eye, rub my eye all the time, so I have to stop myself from doing that. They gave me 2 different drops to take. There was prednisone steroid and a antibiotic. I had to take those each several times every single day for a week. And then after a week, I got to toss the antibiotic, and now I'm just doing the steroids. Started off first week was 4 times a day, second week's 3 times a day. That's where I'm at now. Third week will be twice a day, and then the last week will just be once a day. The only thing that really hurt at all was in my left eye where I had the PRP laser. He wanted me to put the prednisone steroid drops in that night of the surgery, and that just burned a little bit. It wasn't really bad, but it just burned somewhat. The day after surgery, I had an appointment back at the clinic. We stayed in a hotel the night of the surgery, so it was easier because I live 2 hours away from the clinic. It was easier just to go up there and stay at a hotel that we didn't have to worry about driving, getting up super early and driving in the morning. At that point, they took off the patch on my right eye, did a real quick retina exam. They didn't dilate it or anything. All he did was just, he looked in with a scope and said everything looks good. Told me which medicine to take. Before the surgery, I had bought 2 eye patches, this one and a smaller one. If you are having the surgery, if you find out you're going to be having the surgery, or even if you've already had it and you're just a few days out, buy this patch. All right, I'm going to put a link to this patch on Amazon. It was just a few bucks. It's been a lifesaver. I have this big air bubble in my right eye that's been there for 2 weeks now since the surgery. It's obscuring about half of my vision. Every day the bubble gets smaller and smaller, but it's still there. And when I don't have this patch over my eye, or I don't have my eye closed, when I open my eye, light hits the bubble and it just shoots everywhere. It's like a disco ball. So right now my vision, if I have both eyes open, it looks like I'm in some sort of 70s party. There's lights everywhere. Close my eye and it's fine. So if I'm in a halfway darkened room and there's no direct light source hitting my right eye, hitting the bubble, it's fine. I don't have the lights and the floaters dancing around everywhere. Other than that, my vision's pretty good. The bubble's distorting things, but that's to be expected. Once the bubble goes away in the next couple weeks, I should be able to see just fine. So hopefully that's going to be the case. I can drive just fine as long as I wear the eye patch over my right eye. Again, that's to cover up the bubble, and that's to stop the light from dancing around everywhere and just making my vision weird. Really, one of the hardest things is just getting used to using one eye. I bumped into everything for a couple days. Not having depth perception is crazy. I have a lot of respect for people with just one eye now. Driving isn't too difficult with one eye. You get used to it. Really, just the only problem is just gauging distance because you don't have any depth perception. but once you get used to it, it's not too bad. I think the worst part about the entire surgery was having to be face down for a week after the surgery. I rented one of those positioning chairs, basically just a massage chair. That thing has been a lifesaver. And it was $185 the first week, $140 the second week. I went ahead and reserved it the second week just in case I needed it. That's some of the best money I've spent in a long time. If I didn't have that chair, I don't know what I would have done. I'm gonna post a video review of the chair itself, all the equipment that it came with. It came with about, I don't know, a dozen or so different pieces of equipment that you can use. It just made life so much easier. Otherwise, I would have been like this the entire time, you know, straining my neck, straining my back, straining my shoulders. I probably wouldn't have been able to do it. But having to be face down and then having to sleep on my left side with my head pointing down at the mattress was probably the worst part of the entire surgery. When I had PRP laser procedure on my right eye back in March, that was much worse than this surgery, and this surgery was much more invasive. So if you're worried about this surgery at all, don't. I don't want to say it's not a big deal, because it's a very big deal. It's your vision. If you lose it, it's gone. You only got two eyes, and once they go, they go. But I don't want to say it's not a big deal, because it is a very big deal. But the surgery itself was, I guess the word I would use would be a non-event. It's not something that I would stress over. It's not something that I would worry about. You're not going to remember anything. You're not going to feel anything. They said most people just come in, and as soon as they give them the medicine to make them calm down, I don't know what it's called. Most people just wake up, and next thing they know is they wake up in the recovery room, and they're asking, when's the procedure going to be completed? Mine wasn't quite like that, because they wanted to go a different route with mine. They didn't want to have to intubate me and knock me out all the way. But yeah, it wasn't bad at all. It really wasn't. So don't stress over it. Don't worry about it. Just focus on recovery. The worst part is going to be having to be face down for a week after that, trying to figure out what to do. So make sure you have an iPad. Make sure you have a good book to read. You know, I think I watched half of the videos on Netflix and most of what's on YouTube, trying to keep myself busy. I'm going to be posting a lot of other videos in relation to retina detachment, PRP laser operations, diabetic eye disease, diabetic retinopathy, and diabetes in general. There's a lot of equipment that I've used. There's a lot of stuff that I've learned to use over the years. And I have a job where I travel, so that isn't always the easiest thing, being a diabetic and having to travel and lug around all this extra crap with you everywhere you go. You know, most people just want to get on a plane with a carry-on. I really don't have that luxury because I have all this extra crap I have to take with me. But I've come across a lot of stuff that makes life a lot easier if you have diabetes. So please stay tuned. There's going to be a lot more to come. If you have any questions about the procedure, or just what life has been like since I had the procedure, just leave your questions in the comment section below, and I promise I'll get back to you. If you like the video, hit like and subscribe. Have a nice day.